watching the News Hour Special Edition.
Welcome back. India continues to report 41,000 fresh cases of COVID-19 for the fourth day in a row. However, the rising rate of infection in Kerala and the Northeast is a major issue of concern. According to the National Institute for Mathematical Sciences in Chennai, when the second wave of COVID-19 infection was at its peak, the R number was at 1.37. Now, this is between March 9th and April 21st. It further dropped to 0.78 from May 15th to June 26th, but again rose to 0.95 from July 3rd to July 22nd. Now, the Union Health Secretary has held a meeting with 10 states and in fact, the officials of the states have been told that as far as the rising number of COVID cases are concerned, particularly in those areas where the positivity rate is over 10%, they have to bring back restrictions in districts. Let's take this across to our guest now. Joining us with us is Dr. Rahul Pandit, Director of Critical Care at the Fortis Hospital, Mumbai, and member of the Maharashtra Government Task Force. Dr. Indu PS is an epidemiologist and head of the Department of Community Medicine at the Government Medical College, Thrissur in Kerala, joining us. Let me come to you first, Dr. Rahul Pandit, and let me begin by asking you this. The numbers, as far as the R number is concerned, is on the rise. Is this something that should be alarming us? Is it still within a controlled level, or are we looking at the third wave beginning already?
So the R naught or the R number, what we call as, is something which basically tells you about how infective one person is going to be and how easy it going to spread across the infection across in the community. And obviously we want it to be below 1. The fact is that it had gone well below 1, but it's now creeping and it's almost 1 back to 1 now, which is a concern. That means that we may actually have an increased transmission across. And that's why the measures which are well known in the epidemiological circles, like putting up restrictions and obviously having the COVID appropriate behavior, become very, very important. And we need to go back to that. And also, obviously, the pace of vaccination needs to be ramped up so that as many people we can cover up in the next few months. We should do that probably as quickly as possible.
Right. Dr. Indu, how are you looking at it? The state of Kerala has, of course, been in the news for all sorts of reasons. But the fact is that it is contributing somewhere in the ballpark of about 50% of India's national cases. It's very important for states in the Northeast, for states such as Kerala and even Tamil Nadu, which is seeing a rising number of cases, to quickly crack down. However, unfortunately, in Kerala's case, that number of about 12 to 14,000, it was static there for about a month or two. And now it has started sharply rising over the last 10 days.
As we were discussing, the R naught, the number of cases to which one case can transmit the infection, that too with the Delta virus around, with a high rates of secondary death rate and higher transmission potential, is really warrants caution. But on the other hand, we have to also consider what is happening across the world. What is happening to the waves in UK where the coverage was high? What is happening?
I think we've lost that line there with Dr. Indu. We will try and rectify the technical problem and connect with her at the very earliest. But Dr. Rahul Pandit, an important point being made. She's trying to compare what's happened here in India with the experience globally. And we'll talk about the Delta variant, for instance. The infection and the infectability clearly, of course, is much more. All right, Dr. Indu is back with us.
Yeah,
yes,
we have
Dr.
to, beyond
please complete.
Test positivity rate, we have to look at the newer indicators like the proportion of people who are severe, the proportion of people who get admitted to the ICUs, the proportion of people who need oxygen, the proportion of people who require hospitals. As we proceed in the pandemic, it's not always the positivity. Positivity rate definitely, depends on who you are testing. When you have a targeted testing, when the denominator is all people who
Well, we've lost that line there. There's a network problem there with Dr. Indu's connection. We'll try and rectify that. But Dr. Pandit, this is a very important point to note. Not all cases can be compared, says Dr. Indu, because in the case of Kerala, for instance, and this has been noted, it has been noted by the union government as well, that fortunately the mortality levels at the moment at least have been low. And that is a very, very encouraging sign. At least, thankfully, the numbers of those who are dying due to COVID-19 is extremely limited.
Yes. So you can look at a pandemic situation currently into two different ways. One, you can look at a transmissibility. The other, you could look at the severity and the people who are actually stretching the hospital system by getting admitted. So it's good news that we are not having a lot of admissions who are requiring ICU or oxygen, and obviously the mortality is low. That's the first sign to actually show that the vaccination program and probably antibody level in the population is good, and that's giving us some protection. And that should encourage us to actually go and ramp up the vaccination program as quickly as we can. That's one way of looking at it. The other way of looking at it is whether there are breakthrough infection happening, and the vulnerable population which does not have antibodies right now, are they getting infected and how sick are they? I think both are important. The R naught is important, the test positivity rate is important, and obviously the good thing in that is that yes, we have increasing numbers, but not many getting admitted to the hospital. This is exactly what is seen in United Kingdom right now. We've got a large number of patients coming positive every day to the tune of 40,000, 50,000, but the hospital systems aren't stretched and the hospital admissions are very low. But remember, UK has got almost 68% of its population vaccinated. We are nowhere near that, but we are inching towards it. We've got now 10% of the population almost getting vaccinated. Some of the states are a bit ahead than as compared to the other parts of the country. But I believe that we can actually put that systems being stretched, hospital admissions and oxygenation being in the perspective only when we have a large number of population which is vaccinated. Right now, I think both the things need to be looked at in a very, very acute manner.
All right, Dr. Indu, I'm told, is back with us. Dr. Indu, you are making a very important point about the kind of breakup and the numbers of those who are actually eventually infected, and that is very important from the context of the vaccination program as well.
Okay, the vaccination, the ability to vaccinate. For example, yesterday, the total number of people who were vaccinated was more than 5 lakhs. I think today, nearly 4 lakhs. So in that way, if we can go, definitely the vulnerability, the nearly half the population, the Sero survey shows that only 42% have the Sero, the antibodies. That shows that we have to balance these two. Unlike the UK situation where the majority of the population has already been vaccinated, right, that risk is already there. And I agree that with an R naught going higher, we really have to resort to other measures till the remaining population gets vaccinated. But at the same time, it need not be always, since you were mentioning about the TPR and why it should be brought down and down, what the denominator that appear testing are those who have symptoms. When there is an outbreak, and the tested in targeted testing, the symptoms, and those who are on quarantine with high risk exposure, you expect them to be positive. So why do we test them? We test them to isolate them. So that way, that strategy, that's happening, right? Whoever apparently is a high risk contact, majority of them are getting tested. I think that's reflected in the national.
Okay. All right, I think that's an important point. Dr. Rahul Pandit, necessarily is this one of the sort of pitfalls of high testing rates? Because closely tracking and tracing and testing is happening in Kerala. It's borne out by the Sero surveys also of the ICMR is an argument that Kerala has been putting out. But isn't that all the more reason to be very careful and not allow, any kind of religious functions and any kind of pressure groups, whether religious or trader groups, to allow people to come out and gather once again? Because any gathering can lead to the spread of COVID. Dr. Pandit.
Yeah, I agree with you. I think any gathering leads to spread of COVID right now. And when your test positivity rate and R naught are climbing, it's best to actually adopt the simple strategy of increasing your testing, tracing those contacts as quickly as we can, again, testing and isolating them. I think there is no second doubt about that. And obviously all functions whether it is
Okay.
religious, political, non-political, gatherings, playgrounds, everything need to be actually right there at the moment, just curbed down and restrictions to be put on the gathering of people so that we have these numbers under control. And once the numbers are under control, test positivity rate goes down below 5%. You can then take a selective decision to sort of start increasing the people's mobility, to start allowing more and more people to get together. But a COVID appropriate behavior and the functions which are gathering mass crowd will have to be stopped for a long time to come from now.
Well, absolutely. I think that's a very, very important point. And if Dr. Indu is with us, a quick closing comment from her, I'd like to get in on this. Dr. Indu, do you think that somewhere or the other, the Kerala government should introspect about its strategy of allowing people onto the streets? Certainly, we cannot afford any kind of gathering, religious or political or otherwise. And there's been a lot of debate on this, particularly in the northern states. But despite pressure coming in from trader groups, should the state government have held firm and not allow those pressure groups to have held sway? Because clearly that is reflected in the numbers as far as those relaxations are concerned. I think we've lost Dr. Indu once again. We've gotten disconnected with Dr. Indu, but certainly an important point being made over there. Dr. Pandit, just before we end this debate, I'd like to get in a quick word from you as to what you would like to tell people with these rising numbers and people who are in fact going back to work, actually coming into public spaces, markets, malls are all opening. Would you like to give out a message to them about how important it is at this stage for them to socially distance, vaccinate and also mask up, because that really is the key at the end of the day to ensure that we flatten the third wave, and flattening that third wave would be key in ensuring that the numbers do not go to the peak that we saw last in the second wave last time round.
As our Honorable Prime Minister and all the leaders of the country, including the scientists, are saying that the severity and the speed at which the third wave would come is in our hand. We have to be very, very clear that we would adhere to the principles of COVID appropriate behavior, masking, avoiding crowded places at all costs, and keeping your hands washed out. And the most important thing is when your number comes up for your vaccination, please go and take your vaccine. Do not bother about which vaccine is available. As long as you have the vaccine available to you, please go and take. All the vaccines approved under the Government of India at the moment are safe and effective. So that's the only message which I would like to put out. Very simple: vaccinate and mask up. That's what we need to do.
All right, I'd like to thank you so much for joining us, Doctor, and in fact, Indu, as well as Dr. Pandit, for joining us with your views. Certainly very, very important and informative for our viewers as well.